Hi, welcome to Teladoc Health. Thank you for returning the initial paperwork and starting the onboarding process. This is a great company to work for and you're well supported throughout your training, but if you have any questions, feel free to contact us on the email thread you've been using. You'll also have lots of opportunities to ask questions during training and whenever you're working. This video explains the service, what we do, how we do it, and what you can expect as a Teladoc GP. There's an accompanying video explaining the software and how we record notes, do video consults and generate referrals, sick notes and prescriptions, and you'll be given a reference manual in case you need to remember how to do something specific. You'll soon receive your IT logins for your Teladoc email, as well as login details for Salesforce and Amos. These are the two programs we use to consult. You'll also be able to access RotaMaster, the online portal for booking shifts. Now let's take a look at Teladoc and what we do. Teladoc Health is the world's leading virtual care provider and delivers care to over 20 million members across 130 countries. Teladoc UK manages private patients that have life assurance or health insurance that entitles them to various services. Our main clients are Aetna, AIG, AXA, Bupa, Canada Life, Care on Demand and Cigna. We have patients in the UK, the Channel Islands and Gibraltar, and we offer a 24-hour, 7-day-a-week GP service. But from 11 p.m. to 7 a.m. our night GPs take over. We're regulated by the CQC and all our GPs have training and appraisals both within Teladoc and the NHS. Most GPs work in the NHS too and many have specialist interests. We are not currently seeing patients within the NHS, but most of our patients are also NHS registered, and we always need to ensure we know each patient's NHS GP practice. We are 100% virtual and have no physical locations to examine patients. I hope by now you've had a chance to look at the new GP guide, but if not, this is a good opportunity to pause and take a look. You'll probably have questions which are answered in the forthcoming videos, but please do also read the guide. It's only 20 pages but explains a lot. Don't worry though, if you have questions, you can ask them at your one-to-one training. Don't forget to email us to let us know when you've completed the online training modules and we'll book the one-to-one training. In later videos, you'll learn how to use the consultation software and what we can and can't do as a private provider. But now, let's take a closer look at the GP service. The GP service runs 24 hours a day, 7 days a week. Many customers call regarding the same issues one would see in a GP practice in the NHS. Typically, you'll encounter acute infection, MSK, ENT, respiratory, gynecological and mental health issues, but just as in any GP service, there are many other presentations. We don't manage chronic health and we have no access to investigations or imaging. If you feel these may be needed, for example, you may think a blood test would be useful. You can explain your thinking to the patient and then discuss your plan with them. This might be that they go and see their local GP, or it may be that you provide a referral letter and they see a specialist where further investigations can be sought. Working in our GP service is fun and you will be well supported with a clinical lead always on call, seasoned lead GP colleagues, and customer services agents who are always available. And we're all very approachable. In case you hadn't been told, all of your Teladoc work is indemnified and your indemnity is paid for by Teladoc. Our customer services department is central to the way the service works. Also known as General Admin or simply CS, they are crucial administrators who create cases, generate red flag cases, correct patient details, email prescriptions to pharmacy, and underpin GP activities generally. They also ensure ID checks have been requested and manage the flow of referrals to our additional services. So let's take a look at some of these additional services. We offer a number of additional services from 9 a.m. to 5:30 Monday to Friday. Psychology consultations, expert medical opinion, and nutrition consultations. You can internally refer eligible customers for these additional services, but not all customers are eligible, so you need to take care before referring. Customers may also be eligible for private specialist referral, but unlike our internal services, you won't be able to tell who's eligible for referrals to secondary care specialists. But you can always ask the patient. Most will know if they're insured for this. The first thing to check before considering a referral to an internal service is eligibility. All clients are eligible for the GP service, but some have a range of other services available to them: counselling, nutrition, smoking cessation, and our expert medical opinion service. Some can book directly with therapists and nutritionists, but their case may come through the GP service to ensure they're appropriate for the service they've requested. You'll encounter cases like this. Some will need to be called, and others can simply be triaged as safe to wait. Some will need a routine call and a referral internally. We also provide referrals for patients to be seen by consultants and specialists, but we don't refer into the NHS. Each patient's eligibility will be listed under their name when you open their case. The name of the specific service they're eligible for differs depending on who their insurer is, but it's always clear what the service provides, for example, psychology counselling. In this example, a Canada Life patient has burnout prevention, life events counselling, and mental health support all listed. In fact, this is all taken care of by our psychology service. Other patients have a more limited eligibility, for example, this AIG customer and this AXA Global customer. And some customers only have eligibility for the GP service. The psychology service can only offer brief telephone-based counselling courses and isn't appropriate for people at moderate to high risk of self-harm or those with chronic or complex mental health issues. Chronic and complex conditions are often best supported by engaging in longer courses of therapy, and some other conditions require in-person or video-delivered support that allows safer management. You'll encounter a variety of mental health presentations, and we will take a look at this later on, but you should remember that the counselling service has strict exclusion criteria. We also have a nutritionist service. Registered nutritionists work with patients' existing diet and routine to provide recommendations that are simple, practical, and evidence-based. The number of consultations required depends on the goals and requirements of each client, and the service isn't for everyone. They cannot cater for undiagnosed medical conditions, chronic illnesses, or eating disorders, but they do cater for children under the age of 18 as long as they have a GP referral. The expert medical opinion service is really useful for patients seeking an expert medical opinion. You may also see it listed as a second medical opinion or SMO service. They may have had conflicting opinions or be seeking reassurance that their treatment is in keeping with the latest evidence, or they may want to know what the next step is for them. It is a virtual and advisory service. The patient remains under the clinical care of their treating team. If you do refer to the team, please let the patient know that they will receive a call the next working day. One of the EMO doctors will speak to them and determine if they're suitable for the service. So these are some important differences between Teladoc and the NHS. Now let's have a look at the Teladoc patient journey. So how does it work for the patients? Most people download an app, but some use an online portal or call our customer services agents to book a consultation. Many can add family members to their account and book consultations for them too. So we do see a lot of pediatrics, as you might expect. The app, portal and phone numbers differ depending on the insurer. For example, the AIG app is called Smart Health and the Canada Life one is called We Care. Telephone consultations don't usually have a pre-chosen time slot, but videos do and occur every 30 minutes. Once the patient requests a consultation on their app, a new case is created on a website called Amos and in parallel on our appointment software, Salesforce. Salesforce is similar to System 1 or EMIS and where you record your consultation notes. Amos is akin to AccuRx and where video consultations occur. The first time a customer books a consultation, they receive a welcome email and request to upload photo ID to a website called Onfido. Onfido is a company that we employ to carry out formal ID checks. They check and confirm details. Whether or not the patient has completed this process, you still need to do an ID check. You should still check their name, date of birth and address. If some details, for example the address, is missing, you should record what they give you and allow the verification process to check these later on. If you do encounter patients whose ID verification hasn't been done, you can still consult with them, but you need to tell them that you won't be able to send them any documents like consultation notes referrals, or sick notes until the ID has been verified. You won't be able to do any prescriptions for them either, so it's important to remind them about completing their checks. Salesforce is our online consultation platform. It lists all GP appointments, records consultation notes, and generates prescriptions, referrals, and sick notes. Your username to log in will be your Teladoc email, and you'll get a password. It's easy to use, and we'll take a closer look in the next video. But here's the first page you'll see showing the 3 queues that all GP appointments are listed in. As mentioned before, we also use a website called Amos. This is where all video consultations occur. Amos isn't used as a phone or to record consultation notes, but it can be used to transfer notes or documents to patients. You'll get a password and username and should start doing video consultations as soon as you're up and running. Video consultations are done on the hour and half hour. The patient connects via their app and you connect via Amos. You take notes as you consult and record everything back in Salesforce. You'll also be using Microsoft Teams a lot. This is our main communications medium. You'll be added to the GP team, and within that there's a number of channels. You can see all the channels listed here on the left. We have 3 channels that you really need to pay attention to whilst you're in work. Probably the most important of these is at the bottom, the Shift Communications channel. The Shift Communication channel is for GPs to communicate about cases, and as you can see here, it's worth scrolling back when you first start to see what's been happening. The Red Flag channel is for the customer services agents to list cases that they think require urgent attention. The agents have criteria and an algorithm they follow. Part of your role is to acknowledge these cases when you're available to do so. You then have to decide what to do. Finally, the Medical On-Call channel is for you to contact us to ask for any advice. There are other channels as well for education and resources such as patient information leaflets and webinars. Have a look around, they're really useful. Most consultations are done by phone and we call patients using one of 2 recorded lines. It's mandatory to use one of these free lines using your phone. Please save these numbers to your mobile. First, you dial one of these 2 listed numbers. Then dial the dialing tone, usually 0044, and the patient's phone number without the first 0. If you're experiencing any difficulty with this, please tell the clinical lead on call, but don't ever call the patient outside of these recorded lines. We can also text patients, and this is a feature of Salesforce which we'll look at. You may need to request photos or use this for various other reasons. Please don't email the patients directly. This should be done via customer services who can send emails on your behalf. They man their inboxes 24 hours, 7 days a week. There are some ground rules that everybody is expected to follow. You're expected to be logged on to Salesforce, Amos and Teams 10 minutes before your shift starts. And please do check the Teams Shift Communications channel before you begin. Ensure you check your Teladoc email inbox regularly for any updates or important information. Please message your colleagues on the Shift Communications channel at the start and end of your shifts so that the shift lead is aware. And if you need to take a break, please ensure that you inform the team on the Shift Communications channel. Working in the private sector and working remotely presents a different landscape to the one many GPs are used to, and there are some important differences. You have no access to NHS records, so need to be cautious and thorough. You have no facility to examine the patient in person or organise this directly, so need to have a low threshold for recommending face-to-face appointments when necessary. You cannot request investigations, including imaging, directly, but instead can refer to relevant specialists as needed. You may not know the location, address, or NHS GP details and may need to gather these. We have a limited formulary. Our prescribing policy excludes many medications which you may be used to prescribing, and you should familiarise yourself with this. You'll find a guide within the new GP guide, and there's a separate prescribing guide that will be provided to you at training. All consultations are recorded, and we audit consultation notes, recordings and prescriptions to ensure high standards are met, and every patient receives a feedback survey after their consultation. Be thorough, systematic, safe and professional. So what's it like being a Teladoc GP? Shifts are 4 to 8 hours long, and you should take comfort breaks every 4 hours as needed. The shift is run by a lead GP who assigns roles and helps to run the day. You're expected to complete a minimum of 2 video or 3 telephone consultations each hour, and whilst there's no upper time limit on consultations, 20 minutes is frequently and easily enough time for most. Please access your Teladoc email account regularly and ensure your IT and room is ready before you start. We'll take a look at consulting in just a minute and how this differs from the NHS, but one thing that remains the same is that you may need to raise safeguarding concerns as you would in any role as a GP. This isn't common, but there's a safeguarding box within the notes, and you should alert the clinical lead on call if ever you have safeguarding concerns, and tick this box. You'll have access to advice and guidance from senior GPs and clinical leads, and free access to webinars and case discussions, and a very useful library of medical resources, including templates, guidance, and webinars. Have a look. You should start all consultations by introducing yourself and doing the mandatory patient ID checks. Check their name, date of birth, and their address, and make sure you know their current location in case of an emergency. Remember to always confirm the NHS GP details, and for children, document who's present and their relationship with the child. Children aged 16 to 18 years and those aged 11 to 15 with capacity should be asked for consent to share their notes with the parents and guardian and with their NHS GP. Try not to interrupt the patient when they start speaking. Allow them to explain their presentation, and you might find many of your questions will be answered. We have consultation standards assessed using criteria from the RCGP, but with appropriate alterations considering the remote environment, and none of these expectations are above those expected by the RCGP. So let's take a look at the clinical side of things. Every year, over 150,000 patients are admitted with sepsis in the UK, and the figures are rising. 80% arises in the community, and telephone is often the first point of contact. With every patient with a potential infection, ask, could it be sepsis? Ensure you're familiar with the symptoms and signs of sepsis. These present differently in children under 5, older children and adults, and during pregnancy. Remember that the aim here is to rule out serious illness and not necessarily to diagnose. Always consider the most serious potential differentials and ensure you've asked about relevant red flags and documented them. Given our lack of access to NHS records, it's essential to take a full history, including past medical history, drug history, and ask about allergies, vaccinations, and travel. Document examination findings, whether consulting by video or telephone, and always safety net clearly, and discuss follow-up if deterioration were to arise. And remember, if sepsis can't be excluded, face-to-face assessment is required. This short video helps us remember how common this is and how easy it is to miss. Mental health presentations are common in general practice and no less so at Teladoc. Please ensure a full risk assessment is documented for all mental health cases and use our mental health template as a guide and mnemonic. Don't forget empathy. It's very easy to neglect this whilst busy, and it is an essential skill. If the patient has thoughts of suicide or self-harm, use a progressive questioning approach to stratify their current risk. Document mental health examination findings clearly. Tick the safeguarding concerns box if the patient is high risk and discussion with the clinical lead is required. You can then contact the clinical lead on the medical on-call channel. Remember that there are strict exclusion criteria for referring the patient to the Teladoc counselling service. You'll be reminded of these if you try to refer, but do follow them, as otherwise the referral will be rejected. This template is available in the new GP guide. We redirect about 30% of patients to NHS services, and we prescribe in about 15% of cases. You'll encounter patients that require ambulance or A&E services. If the patient appears to be acutely unwell, establish if anyone else is present to assist in calling the ambulance, and keep the patient on the line until help arrives. If the patient is alone, call an ambulance for them and keep them online. Seek assistance as required either from customer services or notify the clinical lead on call via the medical on-call channel. If in-person assessment is needed, choose the most appropriate option, A&E or urgent care centre if urgent examination is required, or a walk-in clinic or their regular GP if it's safe to wait. Explain to the patient why in-person assessment is needed and signpost them where to go. Make sure they understand the time frame, the urgency, give them a safety net should their symptoms worsen. There is an online NHS urgent care finder which is a helpful resource. However, access varies locally, so the patient may need to call ahead to confirm if they can walk in. You should be aware that signposting to 111 may otherwise incur significant delays to the in-person assessment. It's only advised for non-urgent presentations. Always make sure any management plan is clear both in the notes and to the patient, and remember that the notes will be emailed to the patient, so can be used to reinforce advice, provide useful links, and ensure clarity. Do make sure you make them clear. Right, let's have a look at prescribing. Teladoc has a limited formulary. We are not trying to replace the patient's NHS GP. This is due to a lack of NHS records, being unable to examine, being unable to request investigations, and being unable to monitor medication for its effects and side effects. We don't initiate treatment for long-term conditions, and this includes the initiation of antidepressants, contraceptives, and HRT. In fact, any medication that could require titration shouldn't be initiated. Please take a moment to familiarise yourself with the medications we don't prescribe in the list here. This list is also available in the new GP guide. You will of course see many cases involving infection, and some that need a prompt or delayed antibiotic prescription. Antibiotics should only be prescribed if an infection can be reliably diagnosed during the consultation. The threshold for prescribing shouldn't be lower due to being unable to directly examine the patient. If this is needed, you need to explain this and direct them to an appropriate service, such as an urgent care centre. If first-line antibiotics haven't worked, either from Teladoc or elsewhere, it is not appropriate for a second-line antibiotic to be prescribed. Same-day in-person assessment must be advised. Antibiotics should not be prescribed for toothache. Please explain that this is outside the scope of a GP and advise them to seek a dental review. We shouldn't be prescribing antibiotics for animal bites unless you're confident a thorough examination of the area has been completed and you can robustly ensure no functional impairment, such as to a finger or hand, has occurred. Requests for repeat medication are not infrequent. We can prescribe as long as every effort is made to ensure safe, evidence-based and guideline-supported prescribing. The patient should be made aware of our prescribing policy. In any 12 months, we can issue 3 prescriptions for 1 month's worth of any medication, as long as it's within policy. When prescribing, you should note the number of requests made so far. For example, you could write something like, "This is the second request for sertraline, and the patient is aware the maximum is 3 requests over a 12-month period." On the left, you'll see a table with the details that should be completed in every case a repeat medication is requested. You'll find this in the new GP guide. Please use it. You should be confident you're prescribing safely and within Teladoc prescribing policy. If you're unsure, please ask the on-call clinical lead. You should get consent to share the patient's notes with their GP to ensure they are aware we have prescribed, and you should signpost them to the original prescriber for further supplies. This is usually their NHS GP. Ideally, you should obtain photographic evidence of the medication and/or their prescription, but this isn't mandatory. It's important to remember that you have no way of monitoring medications or side effects and won't have any blood tests or measurements like blood pressure on record. If you receive a request for a medication for anxiety or depression, a mental health review is necessary, and this should be the focus of the consultation. If you receive a request for inhalers, you have to ensure the patient is asymptomatic and stable. We cannot treat acute asthma. Instead, you need to direct them for an in-person, same-day examination.